NABN, New Africa Broadcasting Network.
COVID-19, coronavirus, is destroying many lives around the world, and until now there has been no cure. COVID-19 is tearing families apart. It has destroyed the economy of many nations and is separating people who are COVID-19 infected from their loved ones. This virus is rapidly spreading throughout the entire globe. Even the healthcare workers who are responsible to take care of patients are getting infected. There is no telling who will get COVID-19 next, even with safety precautions in place. Until now, there is no proven treatment. Providers have been left helpless with no safe and effective medications for their patients. High Alert Institute and Soleil Kenyan Foundation, SKF, charitable disaster relief organizations, have organized a group of passionate, world-class medical leaders in research and medical specialists based in the USA who have the necessary skills to develop a treatment protocol for COVID-19, coronavirus. NABN TV correspondent Kristen Way was in Florida to speak to Allison Sakara, the president of High Alert Institute, and medical director Dr. Maurice Ramirez, a former senior physician and federal medical officer, emergency room doctor, disaster medicine specialist, and bioterrorism hazmat expert. Their view about the coronavirus and healthcare workers' protection and how soon the virus will end.
First thing you have to look at is the fact that the coronavirus began in the fish markets in Wuhan. The first official reports were in the first week of December 2019. However, there were sporadic reports in social media among physicians of an unusual type of pneumonia as early as October. But if you just start with December and then you track the rise, the peak, and the fall in Wuhan province only, they had their disease under control in late March, 4 months later, 16 weeks. Here in the United States, I know it seems like it's been a very long time, particularly with social distancing, with stay-at-home orders in 41 of 50 states and 2 of 4 provinces. But we still are 12 weeks behind the Chinese. Now, yes, the Chinese had an incredibly aggressive quarantine. And there's a difference between social distancing and quarantine. And their quarantine was enforced by military and police. You were arrested if you weren't wearing a mask in public. There were even instances where people who would not stay in their homes, they welded their doors shut. But you can do that in a totalitarian state. And there were discussions of doing it in Italy. And there are ongoing discussions of doing it in France and Germany now because people are not observing social distancing. The reality is that if you can keep 80% of the population home, regardless of whether it's a 1.5 billion population or it's only 330 million. If you can keep 80% home, the other 20% are going to represent your essential workers, your healthcare, grocers, truckers and transportation, people who bring the supplies that everybody else needs. But if you can keep them home, you can not only flatten the curve, but you can actually decrease the spread until all those mild cases that everyone is wondering about have had a chance to recover. You've slowed the mutation of the virus. You develop what is called herd immunity, where enough people have become immune because they've had the disease, that now they work as a buffer so that the virus cannot spread from person A to person X because it has to go through all the other alphabet who are already immune. When that happens, you can restart an economy early. How much earlier? Well, depending on which version of the Reeves curve you like, the curve that tells us how a virus is going to behave in a population, it could be as much as 6 or 7 weeks earlier to restart an economy. But again, 80% of everybody has to stay home. In the United States, best estimates in the best states, in the best cities, we're only doing 50%. And that means that this virus is going to burn along for about 12 weeks to peak. Now, New York will reach its peak earlier than everybody else because New York has been doing this longer than everybody else. And places that haven't even started on that upward curve, they won't see their peak until mid to end of May because they're going to have to follow the same curve everybody else does unless they get 80% of everybody to stay home. That's my recurring theme on that point, because that is what the Chinese ultimately achieved. And because they achieved that, they were able to shut down transmission until they had enough immune people to block it from moving forward. But don't be fooled. The Chinese are still enrolling patients in trials in the north and the south of their country. They didn't stop the virus. They didn't contain the virus. It was too late. What they did was they stopped one massive peak. They stopped their New York City. And now they're having to deal with it in the rest of their country.
Talking about healthcare workers' protection, Dr. Ramirez explained that,
well, unfortunately, the government can't do a lot. The Strategic National Stockpile is a limited resource. And at this point, the number of masks for N95 style for healthcare that are remaining in the stockpile are being reserved for federal healthcare workers, people who have the same job that I used to have and who will deploy to places that are the next hotspots and will need personal protection themselves. That means now that we have to start getting more creative. We have to start being more proactive as individual providers, and we have to have the government tell large hospital corporations that are used to protecting their image that it's okay for me to bring my own PAPR, or for me to bring my own respirator, or for me to bring my own masks, or for me to wear a disposable poncho because there are no gowns left, and to not retaliate, because in the end, the person whose life is on the line now, healthcare worker. When we work in the emergency room or any place in healthcare, we have this imaginary line. And on one side of the line are patients and illness. And on the other side of the invisible force field is me. And that feeling of invulnerability is what allows you, with your appropriate gowns and gloves and masks and goggles and face shields, to walk into a room with somebody who has measles or COVID-19 or tuberculosis and treat them empathetically as you would want them to treat you if you were on the other side of the line. But when you obliterate that line suddenly, you steal away my safety. You raise my blood pressure. You give me blinders. And it make it difficult for me as a healthcare provider to do my job. So the government can provide that protection so that the healthcare workers, and not just doctors, but more importantly, the nurses and the orderlies and the people who are cleaning the rooms between patients, can do whatever they have to do, whatever they can do, whatever they can find to provide for their own protection.
In my viewpoint, you just can't have enough protection in these sorts of environs. I think that we as a country, the government is ours and we are the government. We as a society are mandated at this point to work with our officials to provide all of the things that need to be provided, to give the support that needs to be given to our healthcare workers, to those who are supporting the healthcare workers, and to all those essential folks in whatever occupation that they are in, that they are letting us be able to take the trains to the hospitals, take the buses to the hospitals, put food on our table for our families before we go to the hospitals. All of those things are critical, and all of them require the same level of protection. They're protecting themselves, they're protecting their families, their neighbors, their entire neighborhoods, and everyone that they encounter. Everyone who works at a mail order facility, putting together groceries, every box they touch, they are sharing what they may or may not have been exposed to with everyone who receives that box. And as a healthcare worker, every person that you encounter, you don't want to share anything that you have been exposed to with your next patient. Yes, we all need to protect against COVID-19, but COVID-19 also opens the door for many other opportunistic infections to follow in its wake. and you may be able to survive COVID-19, and then your challenge is a different type of pneumonia on top of that in the end, or something that you might normally be able to fend off, such as a condition that you live with, diabetes, hypertension, asthma, COPD, but your defenses are down and you are open to a whole host of complications as a result, whether you are no matter which side of that N95 mask you're living.
We're very lucky at the High Alert Institute. As a 501c3 not-for-profit, sometimes our research opportunities are limited by funding. But we have a great corporate partner in medical and regulatory affairs specialists. These are people who, for a living, do literature research. They look into the safety of medical devices and pharmaceuticals, and they help pharmaceutical companies and medical device companies obtain licensure worldwide. They understand what it takes to actually determine that a therapy or a drug regimen is successful. And that's been the problem with COVID-19. Everybody has their idea of what will work. And it's based in good science, the science of antiviral repurposing. It's a molecular biological science. But ultimately, you have to test things in a patient. And when you're dealing with a pandemic, you can't take half of the world and say, guess what? You guys are the controls. You're getting sugar pills. So you have to test real drug against real drug. And if you don't understand the math of how that works, you can very easily choose the wrong therapy. And if that happens at a national level, you can waste millions of doses, which are a resource that you don't get back. So drug stockpiles are used up if the wrong therapy is chosen. So the High Alert Institute, partnering with Medical and Regulatory Affairs, was asked to look at the whole of the scientific literature as it existed in the middle of March. That's 87,000 articles and abstracts. We're fortunate that Medical and Regulatory Affairs has the technology to screen and evaluate those articles without having to have them all read by people, although thousands were read. And they were able to calculate what is called an objective performance criteria, or OPC. It is a regulatory number that regulatory agencies like the FDA, like the European Union, like the Chinese FDA, can use to compare the outcomes of therapies in the real world and determine if they are statistically superior to this minimum success from the literature. If you are better than the literature, you're successful. If you're worse than the literature, you're a therapy that needs to go to the wayside. And now that that number is out there, agencies can start saying, this is a successful treatment. Now, along the way, one of the things they discovered is that very much like HIV and other complex viruses, you can't use a single drug. It just won't work. You're only interrupting the virus in one place, and the virus will go around the drug. But if you interrupt the virus's life cycle in multiple places, 3 or more, you are statistically superior to single drug therapy. That means that interrupting with more than one drug will work, sometimes even with drugs that failed by themselves.
Dr. Ramirez demonstrated how High Alert is teaching hospitals to rebuild power air purifying respirators, known as PAPRs, to help cope with the nationwide shortage of protective equipment for healthcare workers.
What we're going to do today is we're going to show you folks how you rehabilitate or refresh a single-use emergency respirator. We're actually going to turn this into a healthcare PAPR. Now, just like a regular healthcare powered respirator or filter, they come with these filter cartridges that screw into an air pump. These cartridges come either in plastic or steel. Now, the nice thing about the steel ones like this one is that as long as it is not a chemical protection canister, you can autoclave these just like you would autoclave surgical instruments. And once the stripes are on your autoclave tape, the inside is sterilized again. It's been refreshed. Now, one of the big questions is, well, how do I know when I've done that too many times? It's actually very simple. When you screw this in and you put one on the other side and you turn it on, no air will come out because they'll be plugged when they're dead. Now, normally these last for 40 hours and then they're disposed of. But if you autoclave them, you can reutilize them. And experts disagree on whether you can do them 5 or 10 times, but that's 400 hours of added filtration time. That's a lot of shifts. So that's autoclave refreshing. But the other thing that you can do is you can actually cut these open with a can opener. And I think we have a can opener in that box. We're doing this a little bit on the crafty side so that everybody can get an idea of exactly how this works. And I've cheated. I've already pre-opened this one because I didn't want to have to clean up the activated charcoal that's usually inside. But you can take a can opener and you just open it up like you would a can of sardines or a can of tuna. Once you're inside, you will find some activated charcoal, like in your fish tank inside here, and you just throw that away. If you've used this canister before, make sure you're wearing gloves because that will be part of the filter that has been contaminated, so it will have COVID-19 in it. But dispose of that appropriately. And now you have a canister that is ready to refresh. So the first thing that you're going to do is take the top of it and draw some circles on a HEPA quality vacuum filter, shop vac filter. Now, do not try to make a face mask out of this material because you will not be able to breathe through it. Right? HEPA filters are designed to be very tight. They only allow a 0.5 micron, which is smaller than a virus, go through. And we are going to be using an air pump to suck air through that filter, through several layers of that filter, in fact. But once we have this open and cleaned out, we're going to take some gauze, and as Allison cuts us out some circles of filter material, and she was kind enough to cut us a few so that we didn't have to watch her cut forever, we're going to place a little bit of gauze in. Now the gauze is not being used as a filter. The gauze is taking up the space that the activated charcoal used to take up. Right? And then we're going to be placing 8 layers of this material. Why 8? For every 2 layers of 0.5 micron HEPA filter vacuum bag, you get roughly an N70 quality of filtration. So 2 layers, N70. 4 layers is approximately N90. I need 4 more layers to make it to N99, which is what this filter was originally. Now, a lot of people say, what is, and that's 4 layers because she's cutting through 2 layers simultaneously. She's cutting through the entire bag. So now you can see we're set here. And I'll put the top on. And then we get the disaster responder's favorite tool, duct tape, because we're going to duct tape this closed. And we want to make sure that we have a nice airtight seal all the way around because we are going to be sucking through this filter canister. We're going to suck air in this side. It's going to come out here into our pump. And since we have 1 refreshed canister now, and we have 1 new canister, and we could have had 2 refreshed canisters, now our single-use powered air respirator, or PAPR, is ready to go. All it needs is power. Now these emergency escape PAPRs come with a single-use 10-hour battery that snaps on, that comes with nice, pretty cartoon instructions. I'm not going to show you how that works. Because once this is dead, these are usually disposed of. But in the healthcare setting now, we need these. Because we're out of N95 masks in the national stockpile. We're out of PAPRs in the national stockpile. What can be done is you can take the light battery out of your emergency exit lights. And you do have to do a little bit of wiring, and I prepped 1 wire in advance. And you just have to get a wire that fits whatever type of PAPR plug you have. Cut off the other side. And I'm doing one just so that you can see. Strip the wire. And your bioengineering department at your hospital will have all of these parts. Get a little tab here so that it'll fit on the battery. Different batteries have different tabs. That's why there's a whole little canister of them. And you pop that on. Squeeze it down. There are special tools for this, but I use a pair of pliers just to show you that you don't even need the special tools. And you're going to hear this thing come to life. And this is now pushing air. So I'm going to turn it off for just a second because my power cord is my switch. I'm going to hook it up. Now that it's pushing air, it's been tested, so it's ready to hook up. I can set it up with a belt. I can duct tape my new battery to the belt. Can't wear your glasses in the hood very easily, although a lot of people do. And I brought the mic in with me because now I'm protected. I have N99 equivalent filtration, and I'll be able to go for my whole 12-hour shift on this battery. The better thing is that somebody else's battery is back in that light charging during my shift. So when my shift is over, this hood can be cleaned. So we'll take that off. And as I said, these are good for 40 hours, whether it's refreshed or autoclaved. And the nice thing is, when you've autoclaved this to the point where it plugs up, you can cut it open and refresh it with the HEPA filtration. And it, again, 8 total layers, and the gauze to make certain that you keep the filters up against the screw end of the papper. Now, this is important because your healthcare workers need to feel safe. And while you can share this between people, the ideal is that you get enough of them, of course, that this one's mine. And I will be responsible for cleaning it, and I'll bring it back to shift on my next shift. Sometimes that doesn't work. The other question we get is, well, where do you get these? This is where your community can contribute to your healthcare. There are industrial sites, there are sites that deal with chemicals, there are sites that deal with fine particles and dusts and paints that have these emergency and single-use respirator hoods sitting in a box because OSHA requires it. Usually they have enough for the entire shift of workers at their site. If it's a large factory or a large chemical plant, that can be hundreds of these PAPRs. And they could donate those to local healthcare. The bioengineering department can do this just as fast as a doctor can, probably faster. And every frontline person at the hospital receiving that gift now is protected. More importantly, they're not drawing down on those N95 masks that are so precious and so hard to get, which means there are more masks in the community for other essential workers. And that's the reason that we spent the time to figure out how this could be done, how it could be done safely, and apply our hazmat experience to this problem. Yes, the High Alert Institute took a look at the fact that PPE was going to run out, personal protective equipment was going to run out. The National Strategic Stockpile, as I said, is a limited resource. We're already out of masks that can be shared, and we're down to only those masks that are needed for federal healthcare workers. That means that there would be shortages down the line, down the supply chain, through the hospitals and to essential workers in grocery stores, truckers, people preparing food and delivering products. One source that we identified was something called emergency escape respirators. Now these are filter devices, powered filter devices or PAPRs, that pull air through a filter canister, kind of like a gas mask, but you wear it on your waist, and it blows air into a hood. And it's designed to allow you to escape a chemical plant or a nuclear plant in the event of an accident. OSHA requires that all these facilities in your communities have them. And they sit in a box on a shelf until there is that emergency. In this kind of a pandemic, OSHA gives a waiver, and you can donate them to the healthcare. So we're going to show you how to refresh a PAPR canister, how to autoclave a PAPR canister, and how to convert those single-use units into a rechargeable, reusable, cleanable ventilator hood, just like the ones you see on television on the nightly news, for frontline healthcare workers to use. Now, how does that help the people down the line in the other places in the hospital or in the grocery stores? Well, if the people on the front line aren't burning through masks at the rate of 1 million a day nationwide because they're wearing a reusable hood, that's 1 million more masks available every day for everybody else who's an essential worker in the United States, whether that's healthcare or on the road or in the grocery store or delivering to your home. Now that we've gotten that all taken care of and we've rebuilt that PAPR, Allison, can you show us how to keep track of those canisters? Because We don't want to overuse them. We don't want to get to the point where it plugs up while we're trying to breathe with it.
Exactly. You can come up with any way of numbering or marking things that make sense to you and the people that you work with. I don't know one nurse that doesn't enter every single shift and go in and check all the labels and all of the open containers to see when was that can of wipes open, when was that saline bottle open. They've got dates, they've got times, and that's always been part of our labors of love to make sure that all of those things stay appropriately dated and timed. We want to do the same thing with these reusables layers, just so that we have that same protection for these over time. You can use whatever system makes sense to you and your colleagues, but I tend to just treat it like a bottle of sterile saline, and it's just going to get, Monday, Tuesday, Wednesday, on whatever day that was changed, so that I know that this, if I come to work the next day, maybe my pepper got mixed up with somebody else's, I'm going to check this. Does it still have Monday on it and today is Wednesday? Guess what? I'm taking it out. I'm getting out my marker. I'm drawing my little cutouts, and I'm going to fix this before I put it on my face. And I always remember, too, when rebuilding the peppers, 8s. 8 layers, and you'll probably get 8 uses out of it before it stops sucking air when you hook up the battery.
Pandemic will end. And that, I think, is a very important message that people need to hear, because we have to have a feeling of security and control in our lives, and knowing that there is an end provides that. Just like cloth masks for the general public help provide a level of emotional, behavioral health security, in addition to any viral protection they may or may not actually provide. I mentioned earlier something called the Reeves curve, named after Jim Papa Reeves, who was a virologist who characterized the math for a pandemic and many of the factors that change whether or not a virus expands wildly in the population or whether we flatten the curve. And I mentioned earlier social distancing. If 80% of everybody in the nation stays home for 4 weeks, on week 5, we're done.
NABN, New Africa Broadcasting